Welcome to this week's episode of Tracey Talk. I am beyond excited today. I am here in Memphis, Tennessee at the headquarters, the Prince Hall Shriners, who's a fantastic partner of ours, who's been a partner for 10 years and they've just signed on for 10 years more. We have a wonderful episode scheduled for today where we have the opportunity to meet some of the folks, the leadership here in the organization, as well as take a walk through their historical museum. I am here right now with the 46th Imperial Commandress. She is of the Imperial Court Daughters. And so we're gonna walk into the museum, they're gonna give me a tour, and you're in for a treat. So here we are. I don't know, Sabrina, if you could just do a pan scan, just very, very quickly, of what we're in store for today. We are here also now joined by the 43rd Imperial Poente here at the Prince Hall Shriners, AEAONMS. I'm very, very excited. They're going to give us a little lesson in history. I understand there's over 100 years of history here with this organization.
That's correct.
So maybe you can start by just sharing with our viewers who may not know what the Prince Hall Shriners is really all about. Perhaps you can give us a little insight into the organization.
We are a charitable and benevolent organization. We have 200 plus temples and courts throughout the United States. We are in 47 states and 17 countries. And what we have here today is our museum. These fairs are representatives of the majority of our temples throughout the United States.
Wow.
If you notice, each one has a number on it that's telling us what temple it is. Below it, you have pictures of our past imperial potentates, all the way up to including the current and the last, or the immediate past imperial potentate, Carl D. Parker.
Mr. Carl Parker.
Who happens to be with us today. And basic other little things that have happened during some 10 years. You have a picture here of the 40th Imperial Potentate, Homer Buchanan, with a picture with Barack Obama when he was president.
That's cool.
And then you have some other historical pictures showing activities that we participate in throughout the United States.
Wow, that's fantastic. So, can you talk to us a little bit about, you all have been taking on diabetes and this epidemic for quite a while. I think many of us know that diabetes is the biggest health epidemic of our time right now. And it also hits the African American community very hard. 2 times the rate of diabetes in the African American community. So how did you all actually start your initiative?
We were basically introduced to the idea of making it one of our major charity by past Imperial Potentate Oliver Washington. And in his dealings with some diabetes in his family, his wife, as a matter of fact, we started immediately getting that information together. And the organization, when we talk about each other in our organization, it touches almost all our families one way or the other. So it was really an easy idea to sell to the Imperial Council, who is the governing body. And that is now our major baby, the National Diabetes Initiative. And by doing that, we, through our desert conferences, through our temples, we try to make sure that we do all we can to promote knowledge about diabetes, to get the test done to see if you have diabetes possibly close to being done. And then the test by no means just something to give an indication, but then we encourage folks to use that to go to their doctor to get primary care conversation.
We got a real diabetic right here.
All right.
I'm sorry, I didn't. He's making me tell the story.
Please.
I've been diabetic since I was 11.
11.
Of juvenile, type 1. But diabetes is a disease that we control, it don't control us. I've lost 2 toes and a clean bone because of diabetes. I have a daughter who was diagnosed at age 16 that is now 24 and in the military, living a normal, healthy life. And I got a son that was just diagnosed at 25. So it is hereditary, and it is a disease, but we control it. I've done well. I have 501. Right now the rate's about 5.4, which is a very good level. And
I'm a diabetic too, so I know that's a good level.
I came through, I wore a pump for a while going through college, but now I'm insulin free. They say
Praise God
honeymoon
for
or whatever, but
Oh yeah, it's a good
so
thing.
I am.
I'm a diabetic too, and don't take insulin.
Hey, hey!
We are fighting the disease, and in my court, we have been really appreciative to what the community, what the Shrine has done for diabetes. It allows us to get out and be able to educate others, and in our court, we have taken it to the level where we educate and take it to the nurses level. Even at session, we have our nurses that does and help people with their blood sugar dropping. And so we really do support the founding of it.
What if you could share, you know, what are some of the strategies you use to manage your diabetes? Like what
I
really
eat
helps
healthy.
you?
I constantly, I love my fruit. I eat my fruit. I have fresh food at least once a day. They mess with me over there. I do. I don't eat out. I'll cook, even though it's home now. It's just me. Always been not a really fast food person, but I'll bring my lunch. I eat. But the biggest thing is eat healthy and exercise. If you can do those 2 things, you can beat diabetes.
That's what I'm talking about. We're gonna beat it. We're gonna beat it.
Oh,
And
yeah.
Prince Hall Shriners are gonna help us beat it. What else should we experience here? I mean, there's so much.
You can we actually have transactions from our several hour annual sessions. We have them in because usually the general fact that members come in and if they want to start checking something in history, this is where they were starting. And actually that's the minutes of all the transactions taken at each annual session.
Wow. That's fantastic.
We also have the same proceeding, and we call it the proceeding of all of our sessions that we do. We have them way back too for over 100 years. They're kind of, papers kind of falling apart, but all of that because we support it highly. We write here together. We work as a team.
Yes.
To beat this diabetes.
That's exactly right. So what is it? I'm going a little off script, sorry, but I'm very curious. What does it take to become an Imperial Commandress? Like, I might want to be one of those.
Well, number one, it takes some dedication,
Okay.
a lot of hard work, and it takes approximately 20 years to get
Oh,
to this point.
seriously?
I have been in this line to go up to get to this point here ever since 1983. No, 83.
Wow. Okay, can I just get can I just touch
It's a lot of
that?
work, and what people don't realize, we're not getting any salary. It's a lot of charity, community, dedicated work, and love for the organization. You have to love the organization. And being a giver, you have to be a giver.
So, if there is one thing that
Gold.
you all
2001, I'm sorry, I went in office in 2001. I have to stop and think. I started in 1983, but I went into office in 2001 in Detroit, Michigan.
Oh, so wow. Are you from Detroit?
No, I was born in Raleigh, North Carolina, raised in Washington, D.C. I call that between
Oh, the
D.C. and New
Chesapeake
York.
crabs,
I'm one of those ones that have been
She
all
was
around.
elected in Detroit.
Detroit,
Her
2001.
first time she was elected.
Yes, that was when I was elected. So, and I just got to this position last year.
Congratulations. Congratulations.
So,
So if there's one thing you would want people to know about diabetes, like what is it that you would say?
I would say to them, number one, it's one of the number one killers for women, traditionally black women. You need to get checked with your doctor because of all the insurance. If not, find yourself a clinic get tested, eat properly, exercise. That's the key. My family is historical diabetes family. My sister died from diabetes, and she was a part of this organization as well. But the thing is, exercise, eat right, and manage to take care of yourself. You have to watch what you eat, exercise, and it's not easy saying go to the doctor because a lot of people don't have the health care. Find one of the community clinics. A lot of our organization, the temples as well as the courts, sometimes they have a special programs where they'll have doctors come out. We have nurses like at our session. We have the nurse medical department where they do the sticks for all the diabetes, and that's started on the nobility side as well because they're in charge of that medical department, and we have a medical department for the ladies that assist the men in that. So that's important, and we do those checks at Imperial Session every year.
That's fantastic.
Yes.
And how many people come to Imperial Session, just so that people can understand like the magnitude of people you're touching?
Somewhere 10 to 12,000.
10 to 12,000.
That's that we can count. What we always say is multiply that by 4 because each person that attends is gonna have most likely have 4 people that know with them. So you're talking about close to 50,000 people.
That's
Wow.
every year.
Wow.
And if you go to a popular place like we were last year in New Orleans, you may get over that.
Right.
Yes.
There's gonna be more.
Yes, yes. So, Mr. Parker,
Yes, ma'am.
come join us for just talk to us about what you're most proud of that happened under your watch, so to speak, as it relates to diabetes.
Probably the most important thing that I would say is that we brought to a close the 10-year commitment to American Diabetes Association under my administration. That's what I'm most proud of.
Awesome,
Yeah.
awesome. All right, well, Mr. Davenport, I just want to say that we are so excited about the journey that we're going to take for the next 10 years. And we're really looking forward to bending the curve of this diabetes epidemic. So we're at 30 million Americans and growing. And as I told you, 2 times the rate in the African American community. We're going to be very specific on attacking this epidemic, and we want it to be measurable. So the Prince Hall Shriners are gonna come to our headquarters in Crystal City, Virginia, and we're gonna have an agile planning session and really start to plot out together how we are going to actually start to take down this very deadly disease. So I'm extremely grateful and thankful, and I'm looking forward.
We want to break up the stigma that says that if you got diabetes, it's a death threat. It's not. We just got to be able to be diligent to be able to make sure that we get ourselves tested and get the proper care and take care of it.
Yes.
So the Shriners are right there, lockstep, making it happen.
Fantastic. And so for all the viewers, if you got questions or comments, please hit me up on social media. I have a direct line now, so I can get you any questions that you have about the Prince Hall Shriners organization. But more importantly, get yourself tested. Do you know your numbers? And if the answer to that is not, go to the website, take the risk test, and then go see your doctor.
And
So-
in the not too near future, not too far future, all nobles and our daughters who are members of this organization will be able to give out that assistance by pamphlets that we're going to co-produce.
Fantastic. All right, see you at the next episode.